Next speaker is Dr. Rebecca Mouncey. This is a little bit more science, and we have a lot of the times in the studs we're spending a lot of time deciding on how to manage things, and a lot of this is empirical. But Rebecca has spent a bit of time actually trying to produce some data that justifies our decision making, and hopefully will make our decision making more accurate. And as our other half is a stud manager here in Newmarket, I'm sure she hears about the successes and failures all the time. So thank you, Rebecca.
Thanks, Ian. Yeah, so I'd just like to thank the organisers for inviting me to speak today. And yes, Camilla asked me to talk about raising the foal for optimal future performance, which is obviously both a very important topic and potentially an absolutely huge topic. So the way I approached what was probably most pertinent to talk about today was to first of all think, what is optimal performance? And I think it's quite obvious, but we'd all agree if we're commercially minded, attaining the best possible sales price, or and we need to produce horses that have the ability to make it into training, and then when they do, hopefully race successfully. So we've established what we are trying to aim for, and then I basically went through the literature and looked at what is our biggest barrier at the moment with the data that we've got to achieving this. And it's very obvious when you dig into the data available what our biggest barrier to achieving those outcomes is. And it's very much lameness or musculoskeletal injury and disease. And some examples from the literature, these are the most common reasons cited for days lost during yearling prep, the inability of individuals to attend the sales when they were planned to, or to, from some of these radiographic studies, particularly around the OCDs, attaining a reduced sales price compared to a non-affected individual. It's also the most commonly cited reason for horses failing to enter training, and by far and away the biggest cause of days lost during training. I think the figures we got suggest that over 80% of all days lost in training are due to lameness or musculoskeletal injury and disease. And again, even when we're in training, it's the most common cause of failure to make it to the racetrack or to have reduced race performance compared to non-affected individuals. These horses with stress fractures, I think on average have at least over 60 days out of training, so that's lots less opportunity to even get to the racetrack and earn money and do well. So hopefully we can all agree this, in terms of optimizing performance, is one of the most important things we need to try to reduce. And how can we do that? So first of all, we just need to consider what our most common conditions are. So the data on the left-hand side is from some of my work in my PhD, early life. So this is an estimated incidence between birth and about 18 months of age, so while they're on the stud farm. And I've tried to pick studies that give a level of incidence at cases that required veterinary intervention. So on both sides of the table, this is an estimate of the incidence where we need to do something about them. Around a third of foals are estimated to have, with the developmental orthopedic conditions, I've lumped them all in together. So that's our angular limb deformities, our OCDs, our fasciitis, that whole syndrome of conditions I've put together. They're far and away the most common, followed by a sort of more generic musculoskeletal trauma. Now I need to point out that a lot of these, when you read the clinical notes, will have a swollen joint. It was rested for a while and it got better. There could be some OCDs bundled in with there that they just don't get the diagnostics done. So I think in the early life, our developmental orthopedic disease is probably by far and away our biggest headache. Then when we move into training, these figures again are estimates over a sort of 12-month period in training, and this, as you'll recognise, is very much from a flat racehorse population, mainly 2- and 3-year-olds, which is why our dorsal metacarpal disease or sore shins has the highest instance. Our fractures then, and then tendon and ligament injuries. If we were to move to a slightly older racing population or more national hunt, the relative proportions of these would change. Our tendon and ligament injuries would become, the incidence would be higher, but I think our top 3 conditions that cause us a headache would probably remain the same. So these are ideally the things we're looking to see if we can reduce the incidence of. So I suppose if we're thinking about how we can, in a perfect world, prevent these things, or at least reduce them, We just need to have a quick think about what actually, I've put in inverted commas, causes them. The biggest challenge we've got with developmental orthopedic disease, which many other people have alluded to today, is we honestly don't exactly really know. It's complex, it's multifactorial. It's clearly got a really important congenital component. So there'll be an awful lot of individuals that are, unfortunately, by the time they're born, which is the period of life I've been asked to talk about from birth onwards, what can we do? They're slightly predetermined or destined to have it, or they'll have been born with a congenital form of it. So we're more thinking about what can we do to minimize how bad that is, or do something to not make it get worse. We know, particularly when we're talking about the osteochondrosis presentation of this, that some of these lesions are actually quite dynamic. When they've done studies where they've screened them quite frequently every 6 months, there's a lot of change, certainly radiographically, in how these lesions look. When they've done histology studies, so taken little bits of tissue and studied them in great detail on the microscope, there's definitely a traumatic component to these osteochondral lesions. So although obviously there was something went wrong in the developmental process, that the cartilage in that joint didn't form properly, probably during early life it received trauma for whatever reason and made it worse. So there's potentially some things there we could do to slightly improve the situation. And of course, I'm sure, as we're all now really familiar with, our fractures and tendon ligament injuries, these are not acute events. You know, those catastrophic fractures even that very sadly occasionally happen on the race course, they're the end point of a series of accumulation of damage over time. And very much the same with the majority of tendon ligament injuries. So that bone is just accumulating damage over a period of time. And the reason I'm saying these things, which are obvious, we know, but just when we're thinking about how could we prevent these, if we can either prevent the damage over time, which is kind of a training thing and out of the scope of this talk, but if we can make the bone fundamentally stronger in the first place, it will be more resistant to injury. And again, with our developmental orthopedic disease, if we can think about things to reduce trauma, that may also be helpful. So that's kind of what I've got at the bottom. During early life, are there any ways that we can prevent or reduce the incidence of these conditions by improving the strength of our musculoskeletal tissues to withstand training and what horses need to do in later life, and resist injury whilst also avoiding trauma? I think that would be our main objectives. So how could we potentially do this? I'm very fortunate that Pascal explained this really well this morning, so that's absolved me of having to go into huge detail about the science of this, which I'm really grateful for. But just to summarize the principle of this developmental origins of health and disease theory, I've tried to make a picture, which I'm not sure if it's helpful or not, but this is your risk of disease or injury through life. So as we get older, we're more prone to disease and injury. That's what the non-dotted line is. That's kind of our baseline over time. And this is just, the dotted lines are basically demonstrating if we make an intervention or change our management at certain stages, how much effect is it likely to have. So if we wait until adulthood or wait until we show clinical signs of a problem, we can make an intervention and it will have a little bit of an effect, but rather depressingly, it's slightly small. And this goes for screening. You know, once the lesions have already been there and are established and then we look for them, there's only a limited amount of things we can do about them at that point. But where Pascal was talking about right back here, you can see if we were, you know, in the position to know exactly what we needed to do and made the right intervention then, this can have a huge effect. So, you know, like Pascal alluded to, if we could find these biomarkers that we desperately need to identify, so we can identify our at-risk individuals and make changes, the potential there is to have a really good positive effect. And that's what we're all working so hard to kind of get that situation. So in early life, we're in this middle bit here, where we've still got, the reason that this principle stands is, as Pascal described this morning, during periods of growth and development, the tissues have what we call a really high amount of developmental plasticity. That means they can still respond and change, see the epigenetic mechanisms and respond. So the window during early life is still very much open for us to have an opportunity to improve things or make them worse. It's a two-way thing here with what we do with these animals. So it is possible to optimize musculoskeletal health, and we can go in both directions during early life. So these periods where you've got really high developmental plasticity are critical, and they're critical in both directions, which is why they're so key, and we must be so mindful and constantly monitoring and measuring what we're doing, because there's a lot of potential for positive, but there's also a lot of potential for negative as well. So hopefully now we're convinced that we have got a window where we can do something. Where is this window? When is the optimum time? And really the amount of developmental plasticity that you've got is directly correlated to how rapidly you're growing and developing at that point. So it's these periods. This is just a rough shape of the growth curve in terms of body weight at the top and wither height at the bottom. And you can see it's the first 6 months where you get the periods of rapid growth. I thought it was super interesting, the data that Joe presented earlier about this second period of rapid growth, and that's another potential danger or positive area where we need to be really mindful what we're doing. But certainly the first 6 months of life for sure is where we've got the greatest developmental plasticity, and we have to be mindful as well, we're going to close this window probably prematurely when we wean, which generally we do before 6 months. So it's that period of time before weaning, greatest opportunity to make either positive or a negative effect. What we know from some studies, sort of more in the lab, looking at the tissue's behavior, we know that bone and muscle does have obviously an ability to adapt throughout life, but by 24 months of age, you've got your peak adult bone mass at that point. So the window to make a really significant change occurs then. But what we know about cartilage, tendon, ligament is that they probably reach their adult structure actually earlier, around 12 months of age. And articular cartilage is particularly interesting because it has very rapid cellular turnover in the first couple of months of life. But after 6 months of life, there's very little activity that we can detect. So really for your joints, it's the first 6 months that you need to, if you're going to make a positive effect, that's your critical period. So we know when we're going to do it, what are our options around what we can do. So basically, in early life, it's these three factors which clearly are incredibly interrelated. Again, I'm very lucky today because Joe's here, who's very expert about growth and nutrition, so that's absolved the need for me to talk about those topics, which is also great. So I'll just stay in my wheelhouse and say something about exercise. But really, probably the most important message to give is that there's no magic bullet for this, okay? The solution lies, we're going to get the best possible result by optimizing all of these things together. And we really need to get in the habit of considering these things all together, all of the time. So we're going to have the greatest success if we optimize all three of these things. You know, you could have the best possible diet in the world, but if you're not managing them correctly, it won't be very effective, and vice versa. We've got to think of these things. They're so intrinsically related together. And obviously, the other thing, just to give us even more work to do, is that the requirements of all of these three things change with age. So we need to be constantly on top of it and constantly questioning and adjusting what we're doing. Right, so I'm just going to talk about exercise and activity. And what do we know about this? What potential does it have? So the whole point, or the positive attribute that our musculoskeletal tissues have, is that within this window of developmental plasticity, so that's going to be the first 6 months, ideally, we have what they call a loading dose-dependent positive adaptive response up to the tissue stress limit. They always have complicated ways of saying this thing, but basically, more loading, more positive adaptation, and stronger tissue in the most basic sense, up to the tissue's limit, obviously, if we have extremes in either direction. The other thing that's important is that the loading response is proportional not only to the force of loading, so we need a minimum force that we need to apply, but actually, interestingly, particularly for bone, but actually for the other tissues as well, it's this frequency of loading is quite important too. So they don't just need a physical amount of loading force, they need that regularly across time as well. They're the two things. In terms of the tissue's capacity, so like we said, bone and muscle have the most capacity to respond, and then tendon, ligament and cartilage is probably the least responsive, but it is quite active in the first few months, so there is a small window where we can maybe do helpful things. And as the tissues get bigger, so physically bigger the horse grows, the loading requirement for positive adaptation increases, so they need to be doing more loading force and more frequency of loading as they grow. The other thing to bear in mind, and which is that bone's response, I've called it bidirectional, but what I'm basically getting at is that if you don't put loading force to bone, it actually starts to resorb tissue, so you lose bone mineral density. And this happens quite quickly, sort of within if you stuck a horse in a box within 3 weeks, it would start to lose bone density, which I always think is really interesting. For example, around yearling prep and things, when often these horses don't get turned out and they're in a box doing quite low intensity exercise, we're probably losing bone density towards the end of our yearling prep, and then we're going into training after that. Just something to think about. And also the neurological system, obviously don't underestimate the positive effect of activity and exercise in terms of developing that and improving your coordination, which is probably quite important to be a racehorse. So what we know, there's balance. So there have been some small experimental studies done where they essentially expose foals to extremes in either direction. So there's a study done where they shut foals literally 24/7 in a box for 5 months, and they had another group that were equally shut in a box 24/7 for 5 months, but they took them out once a day and ragged them around a menage, chasing them at high-speed gallop. And then they had a group that they just turned out in a pasture like normal horses. And probably unsurprisingly, but when they had the box rest, it literally delayed the development of the musculoskeletal tissue. So when they looked at these tissues, they were like in the 5-month-old foals. When they looked at the tissues histologically, they looked like that of a newborn foal. The developmental process has almost been entirely halted. So they had reduced bone mineral density and reduced cross-sectional area. They had smaller, much more immature tendon tissue, and exactly the same in the cartilage. And then when you go on the other extreme and do too much, or extremes of exercise, you just induce tissue damage and trauma. Interestingly, with bone, when you traumatize bone, it likes to resorb itself too, which is not tremendously helpful either in that situation. Some of the chondrocytes, the cells in the cartilage, actually were killed off, and you got reduced extracellular matrix in your tendons, so they became very brittle and poor quality. The one positive to take from this rather hideous-sounding study is that in the group that were shut in the box, after that, they turned them out 24/7, and when they re-examined them at around 18 months of age, the tissues had to some degree regenerated. So if we do have to shut horses up in a box, it's not a complete disaster, which is great, because sometimes we need to do that. And the tissues do have the capacity to regenerate. We just need to remember that when they come out of that box, they have the joints of a very young foal rather than their actual age, and we need to be probably mindful of that. So in terms of, we know these horses need to do some activity, and that's positive. How can we affect what activity and exercise they take? Because obviously these, we're not riding and exercising these horses at this age. So what do we know about behaviour and management? So if we look at foals, if we just take thoroughbred foals, these are studies where they've put GPS trackers on them and just let them do whatever they want. So they're in a management out 24/7, and there's no sort of fences or small paddocks to constrain what they do, what would happen. So they would normally in the first few days of life travel up to 7 kilometres a day with their dams. They cover big areas. It's also interesting to note that their total workload, so the distance times speed that they undertake during the first month of life, is actually twice that of the following 3 months. So in that first month, they're really surprisingly active, which is probably because they're not grazing, I guess, and they're suckling, and then they just gallop around like lunatics the rest of the time. So it's interesting that that in the sort of wild state is what would happen naturally. And also the total time they spend in what they call play activities, which is just cantering, galloping, rowing, bucking, playing around, the total time they spend doing that decreases as they get older. But although they do it less frequently, the intensity of the activity increases. So that's what happens if they're left their own devices. Why do we think these things are important? We think the play behaviours are important because they're the activities that are applying these extra loading forces to the tissues above the tissue threshold that are important to stimulate this positive tissue adaptation. So this cantering, galloping and high speed stuff is important. And as the foal grows, we know we need greater loading force and therefore play intensity, and they do exhibit that in the sort of wild state. Total workload we know is important for mechanical stimulation of the collagen network within the articular cartilage within the joint itself. And we know that this has a really rapid turnover in the first month of life. So again, it doesn't seem to be a coincidence that the foals naturally are more active in the first month of life when that tissue needs that, when they're just left to their own devices. So if we keep this in our mind and then think about what we tend to do with them, these data are from some work that I did in my PhD, where I established a birth cohort on thoroughbred farms across the UK and Ireland, and people very kindly recorded the location and duration of turnout that they received daily for the first 18 months of life, which was a huge undertaking, but has provided some incredibly interesting data. But just to give a rough idea of average management practices, in the first month of life, the average daily turnout time was 4 hours a day. Obviously, in the first few weeks, it was less and more towards the end, but when you average it across the month, that's what it was. The average turnout area in the first month of life was paddocks of an acre or less. And in general, foals didn't receive 24/7 group turnout in larger paddocks until around about 4 months of age. That was sort of the average practices of the stud farms. We know that foals in a stable can only travel a maximum of 1 kilometre a day, and in a 2-acre paddock, if they're out 24/7, they can do 5 kilometres. So clearly our workload is going to be different from what we looked at on the first slide. And we know that from behavioural studies where they've put trackers on and put horses in all sorts of different settings, we know that small groups in small paddocks cover lower total daily distance and have a reduced frequency of play behaviours. The other thing that we know about our more less extensive practices where we have horses in a routine of being stable and going out is that horses frequently display these, they always give everything a fancy name, but compensatory rebound, high intensity activities. So they go a bit mad, run around a lot, fight when you turn them back out. And obviously these behaviours that are very high intensity with the aggression can sometimes predispose to trauma and injury. So we can see then that our turnout practices basically do have the potential to impact the activities these horses undertake and some of their behaviours while they're out at pasture. So what do we know, what data do we have so far about what may be good practice and what may be possibly things to avoid? So the first message really is avoidance of practices that increase the risk of trauma or injury, which sounds fairly obvious because clearly none of us want our horses to get injured. But actually it is worth just thinking about this a little bit more, and is there anything more that we can do? So from my study, a big message that came out was that alteration to turnout routines in terms of timing was associated. So if you made an alteration to your turnout time routine, horses were 8 times more likely to have an episode of musculoskeletal injury or disease. So, and we very much think this is because these practices promote compensatory high intensity activity and aggression. So examples of these that I observed in my study would be, the horses come in for a few hours for the farrier, then get turned back out again, and they go bonkers when you put them out, and things like that. So they were sort of examples. There's been quite a few other studies done, but very much more in the context of osteochondrosis, of OCD, but there's been associations with turnout practices and the risk of OCD as well. So we know that in studies where they looked at OCD, where they were diagnosing it radiographically, horses that were kept in winter barn housing had an increased risk of OCD, of a higher instance of radiographic OCD, the same as the use of rough pastures. And in the OCD studies, they found alterations to turnout timings, again, similar to I did, and then changes in groupings or changes in turnout locations. And again, that's probably around all of these things, increasing these high-intensity activities and horses going mad when you turn them out again. And we just need to be really mindful, because these OCD lesions definitely have a traumatic component to them. So although we don't know how to completely stop them, if we can minimize trauma across the joint, we can certainly reduce the severity of some of these lesions. And we know that lack of forage or grazing can encourage these behaviors as well. So as well as these changes to turnout routines, just lack of forage, they basically go looking for trouble and start fighting and playing. And it was just interesting in my study, just looking at the rates of musculoskeletal disease and injury. They were much highest in that winter of the first year period, when that does probably coincide with less grass availability and things like that. So do we need to be thinking about giving them something to occupy them in the field so they're not getting into trouble and making their OCD worse? So just things to think about. The second sort of big message that comes out of what data is available is that the use of practices that promote activities to stimulate positive tissue adaptation are helpful. So what was interesting when I looked at the data to try and find when it might be helpful to use more extensive turnout practices, it was very interesting that it was very significantly this 4th month of life, so that end of the period of very rapid growth just before we're going to slow it down with weaning. Farms that used larger turnout areas with the foals turned out 24/7 during that period had a really significantly reduced rate of musculoskeletal disease and injury between 6 and 18 months. So that affected going forward the rates of musculoskeletal disease and injury that these foals had. So this is just a graph sort of out of the final model where we've got the relative hazards, so the relative rate of musculoskeletal disease and injury between 6 and 18 months versus the size of the paddock that you were in the 4th month of life. And you can see these paddocks less than 4 acres were associated with a significantly higher rate of musculoskeletal disease and injury. Obviously, paddock size and group size were highly correlated, so this would be them in bigger paddocks, in larger groups, and also turnout time was a confounding factor, so this effect was greatest in horses that were turned out 24/7, so those extensive practices at that time in life. And this is probably because these extensive turnout practices increase the total workload and play activity, because we know as these horses are coming towards the end of that phase of rapid growth, that's when the largest forces are needed to stimulate the positive adaptation. So they probably need to get quite high speed when they're galloping around the paddock, and if they've got more space and other horses to interact with, they're probably more likely to undertake more play and do more total workload. So their tissues were perhaps more likely to be exposed to sufficient workload and loading force, that they were better adapted than the tissues of horses in smaller paddocks or less extensive turnout, and so they were relatively more resistant to disease and injury. Now, I've followed these horses into racing and training, because obviously that's ultimately what we're all really interested about. And the data collection for that's still ongoing, so I've only got preliminary results. But again, this use of this more extensive turnout practices in early life seems to be associated with increased odds of entering training and racing, but I haven't gone through the performance stuff, and that's very preliminary. So, but it's looking promising for that as well. So I guess my take-home messages would be, if we think back to that graph that I tried to draw of the developmental origins of health and disease, if you're going to screen, we need to do it early, because we ideally need to identify our problems while that window of developmental plasticity is open, so that we've got the option to do something about them. I really think the solution to try and solve these problems lies around integrating what all of us have talked together about today. So there's no magic bullet. We need to optimize our growth, our nutrition, and our exercise or our management practices together to have the best effect. Where possible, avoid turnout practices that increase the risk of trauma. So if there are any, if you've got minor trimming to do and stuff, do they have to come in for that? Or, you know, can we just look at how we're doing some of those management things, or at least at those critical areas of growth? So like that winter where Joe really nicely demonstrated today, there's that secondary spurt of growth. Probably that's the time we don't want them galloping around like lunatics in the field. That's probably a risk period. So it's just thinking, you know, if there's any adjustments we could make, it could make a good amount of difference. And where possible, try and keep your turnout practices pre-weaning as extensive as possible. So get these foals turned out 24/7 in larger paddocks as early as possible to do, because that definitely appears to have a benefit. So yeah, in conclusion, the keys to optimizing future performance are for sure held within gestation and early life. Those are our windows to reduce the incidence of the problems that we see much later life in training and racing, and reduce the incidence of these developmental orthopedic conditions. And I also do think we could do something to reduce the risk of stress fractures as well if we were producing animals with more positively adapted bone tissue as well. That's definitely an avenue. There's absolutely no magic bullet. You know, you can't just do one feed supplement and all your problems will go away. We have to address all of these things together. It's not simple. It's a real pain because the requirements change with time, and we need to exercise balance and constant adjustment, which takes more work, unfortunately. So it's not easy, but I do think if we can keep looking at the details and keep questioning what we're doing, could we change anything? Is everything looking okay? And make an intervention early. So if it's looking a bit jointy or a bit footsore, that's the time to make an adjustment to what you're doing, rather than 6 months down the line when it's got positive x-rays before you want to sell it. Thank you.
Thank you very much, Rebecca. Yeah, that's the science. That's absolutely the science. And these are a lot of things that we suggest or we think we maybe know, but having the science to back it up does help us commit to these changes. So any quick questions before we move on? Here we go.
Hi there. Yeah, just a quick one. Have you found any correlation between the age of weaning and musculoskeletal problem?
No, I haven't in the data set that I've got, although I have to say the majority of people tend to wean very much around the same time. So I had very little variation in the weaning data. Most people weaned between 4 and 5 months, kind of, yeah. So I can't really answer that. There was no association with weaning date in my data set, but pretty much everyone weaned at the same time. So